Ozempic teeth sounds like semaglutide chemically rots enamel. Current evidence does not show that Ozempic or Wegovy directly damage enamel. The real risk is indirect. Side effects can change the mouth's environment. Vomiting or reflux exposes teeth to stomach acid. Dehydration and dry mouth reduce protective saliva. Together, repeated acid and low saliva can raise the risk of erosion, cavities, and sensitivity over time. Ozempic mimics a natural appetite hormone signal called glucagon-like peptide 1. It can slow stomach emptying and reduce appetite. That can cause nausea, vomiting, burping, or acid reflux. Poor intake, vomiting, or diarrhea can also cause dehydration and further reduce saliva. That pattern explains the concern. Ozempic's prescribing information lists nausea, vomiting, diarrhea, abdominal pain, and constipation among common reactions. Tooth decay is not listed as a common direct reaction. The recognized risk comes from dry mouth and acid exposure, not from the drug chemically dissolving enamel. One published report described 3 women who developed severely reduced saliva after starting semaglutide. Saliva production improved after different approaches, including stopping the drug, saliva-stimulating medicine, or symptom care. 3 cases cannot estimate how common the problem is or prove semaglutide was the only cause. The report gives researchers a concrete reason to study whether semaglutide can reduce saliva in more patients. Major Ozempic trials were designed to measure blood sugar, weight, heart-related events, and general side effects. They were not designed around detailed dental examinations before and after treatment. Dental-specific studies are needed to measure rates of dry mouth, acid erosion, and cavities accurately. Dry mouth has a recognizable pattern. You may need water to swallow dry food, wake with a sticky mouth, or develop burning and altered taste. Bad breath may increase and lipstick may stick to the teeth. These signs point toward reduced saliva, not instant tooth destruction. Acid injury looks different. Repeated reflux or vomiting can gradually wear away enamel. Teeth may become sensitive, look smoother, or develop thin edges. This is called dental erosion, and it differs from a cavity caused by bacteria feeding on sugars. The distinction changes prevention. Dry mouth raises the chance of cavities because saliva no longer clears sugars and supports enamel repair. Reflux and vomiting expose teeth to acid directly. Someone can have both pathways together, especially during a difficult dose increase with poor fluid intake. Compare 2 people taking the same dose. One drinks enough water, has no reflux, and maintains normal saliva. The other vomits weakly, sips sugary drinks, and wakes with a dry mouth. Their dental risk is completely different, even though the prescription is identical. Food changes can add another layer. Some people replace full meals with sweet coffee, sports drinks, juice, or frequent small snacks. Others use sugary candy all day for nausea or dry mouth. The injection did not chemically attack their teeth, but the new routine repeatedly feeds acid-producing bacteria. Beyond diet, a tooth that cracks after starting Ozempic often began weakening before the first injection. Old cavities, large fillings, gum disease, and nighttime grinding can remain silent for years. A crack appearing after Ozempic can still reflect damage that started years earlier. Treatment-related dryness or acid can expose a weakness that was already present. Diabetes can further confuse the picture. Higher blood sugar can worsen dry mouth, gum inflammation, and infection risk. Smoking, sleep apnea, mouth breathing, some antidepressants, allergy medicines, and blood pressure medicines can also reduce saliva. Blaming one injection may hide the stronger cause. Better blood sugar control can reduce gum inflammation and make infections less likely. However, it cannot repair cavities or enamel already damaged by acid. The medication's overall effect on dental risk depends on side effects, habits, and existing health problems. The timeline still matters. Dryness beginning soon after a dose increase suggests the medicine played a role. Reflux that appears during the same period strengthens that link. One broken tooth without dryness, vomiting, or widespread enamel changes points more strongly toward a local dental problem. Timing helps, But bad breath alone is weak evidence. It can come from dry mouth, reflux, gum disease, tongue coating, smoking, or fasting. A new odor after starting treatment deserves evaluation, but it does not identify the cause. The surrounding symptoms provide the useful clue. Once you identify the likely pattern, reduce the exposure causing it. Dryness, reflux, vomiting, and frequent sugar each need a different response. Record when symptoms occur, then match prevention to the problem instead of reacting to the label alone. A 7-day record can make the pattern visible. Note dose day, vomiting, reflux, fluid intake, hours of dry mouth, sugary drinks, and tooth symptoms. A clear cluster after injections helps your doctor and dentist decide whether symptoms follow the injection schedule or point to another cause. For mainly dry mouth symptoms, start by checking hydration and other drying medicines. Sip plain water regularly rather than drinking large amounts only at meals. Sugar-free gum can stimulate saliva when chewing is safe. Avoid constantly sucking sugary candy because that trades dryness for repeated sugar exposure. Fluoride toothpaste becomes more important when saliva is reduced. Fluoride helps harden enamel and repair early mineral loss. Brush twice daily with a soft toothbrush. A dentist may recommend stronger fluoride toothpaste or a fluoride treatment when cavities are appearing quickly. For reflux or vomiting, controlling the stomach problem protects the teeth better than adding more brushing. Report persistent nausea, nighttime reflux, or repeated vomiting to your doctor. The dose may need to remain lower longer, or the timing and meal pattern may need adjustment. After vomiting, rinse with plain water. Do not scrub the teeth immediately while acid has softened the surface. Wait at least 30 minutes before brushing. This reduces the chance that brushing will add extra surface wear to enamel already weakened by acid. The same targeted approach applies to the medication itself. Do not stop Ozempic automatically because of one dental symptom. Stopping may worsen blood sugar or reverse weight progress while leaving the actual dental cause untreated. Identify dryness, acid exposure, diet changes, and problems in individual teeth before changing a useful medication. Increasing the dose deserves special attention because stomach symptoms often worsen then. A higher dose is not a test of willpower. Repeated vomiting, inability to maintain fluids, or severe reflux means the plan is not working well enough. Contact your doctor before increasing the dose again. A dental examination can distinguish acid erosion from cavities, gum disease, or a cracked filling. The dentist can compare current findings with older X-rays and photographs. Widespread smooth wear suggests repeated acid exposure. One damaged tooth usually suggests a local weakness rather than a medication-related pattern affecting several teeth. Seek prompt care for facial swelling, fever, pus, severe tooth pain, or trouble swallowing. Those signs can indicate a dental infection and are not explained by ordinary dry mouth. Repeated vomiting with very little urine, dizziness, or inability to drink also needs urgent medical assessment. Ozempic has not been shown to directly rot teeth, but its stomach effects can create real dental risk. Protect saliva flow, reduce repeated acid exposure, use fluoride, and investigate new damage early. The label is dramatic, but repeated dryness and acid determine whether your teeth are actually in danger. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.